Well, to talk more about this zero COVID policy, we're now joined by Gideon Chitanga, who's a research associate at the African Center for the Study of the United States at the University of the Witwatersrand. Gideon, thanks very much indeed for joining us. Always good to talk to you. Thanks for your time.
Thank you.
All right, perhaps we can start by getting an explanation. What is this zero COVID policy? What is it exactly?
So in terms of the policy, this is a policy that's been adopted by the Chinese government and very strongly to protect, as the policy states, public safety, to resolutely address the problem of COVID by imposing or by using lockdowns as a way of minimizing the spread, the quick spread of the disease, and then followed by interventions that relate to tracing infections, providing the requisite medical provisions. I think in principle, this is what was applied when COVID began, and it was the same model that was eventually globally adopted to arrest the quick spread of COVID. So we can talk of this policy as one of the major models because it was adopted by the World Health Organization and later accepted by, I guess, every other government in the country. The difference with where we are now is that other countries have moved to open up their countries, and China faithfully sticks to this policy for very specific reasons, and particularly because of the high population in the country, about 1.4 billion people. The demographic characteristics are such that there's a high population of elderly people and children who are more vulnerable. And the concentration of population in Chinese cities in the sense of population density cannot be compared to, for example, Western cities. So the primary approach is to make sure that cases of COVID are quickly identified, isolated, and the patients are quickly attended to, and as they recover, the spread of COVID is either mitigated or minimized.
All right. So what's been the impact then of all of this zero COVID policy strategy?
There are two ways of looking at the policy impact. Obviously, the general impact of lockdowns has been to affect economic activities. But I think that governments are faced with a delicate balance between the quick economic gains and the medium to long-term benefits of public safety, and creating conditions where business can thrive without opening their countries to the higher risk of COVID, which might actually be counterproductive. So I would say that what we are hearing as concerns that are coming from business are not different from the concerns that, or the debate that was always there when lockdowns were applied. The only unique part in the case of China is that the government of China has said it will faithfully stick to this policy of zero COVID with a view to provide for public safety as the main primary objective given the threat of COVID. And their demographic characteristics and dynamics, I believe they justify such an intervention. The concerns of business, they are quite important concerns, but I think depending on who is assessing the issues, the concern for public safety, it can create better conditions for business in the long run, in the medium term, than allowing COVID to spread and risking the whole population in the shorter and the long term.
All right, so the WHO says that this approach is unsustainable, and Michael Ryan, who's the WHO Emergencies Director, says that you should actually see some respect to individual and human rights. People in Shanghai recently, they were banging pots, complaining about government action, being locked away for so long. So isn't there a balance between, yes, trying to get zero COVID, but on the other, individual rights and desires?
You are right to raise concerns about individual rights and desires. And I would group these individual rights and desires with the interest of business in terms of their complaints. I think it is in the nature of human beings to want to be free and exercise their liberties. But I also believe that it is the role of the state to also promote national interests. And national interests should be such that they resolve those problems that broadly affect the community. I have seen one report from the one analyst linked with the World Health Organizations, which suggests that in the case of higher populations, high population density, sometimes if you consider the mutations of COVID and the speed with which it spreads, and the idea that vaccinations are actually failing to effectively address the problem. If you look at countries that have opened themselves up and allowed free economic, social interaction and economic activity, they've said that they've made a choice to live with COVID. I think that it's a cautious choice that is made under the pressure of business interests, not necessarily individual rights, because I think individual rights can easily be subordinated, as we saw in the first phase of the introductions of lockdowns. So depending on what a country might choose, I think that lockdowns are the most effective way of arresting the spread of COVID. Vaccinations are helping, but the mutations are increasing at a faster rate. Natural immunity is also failing. So a lot of countries have not realized herd immunity, which is the main objective and the main standard that is used to justify to open economies. And we are still, I think, living in the era of COVID. And I would say that allowing societies to experiment with what works best for them, it gives the world a chance to either embrace or integrate the different models and approaches that we are working with. And in the case of China, I think that it is exercising its sovereign right to be very responsive to its domestic interests and needs.
All right. Gideon Chitanga, always good talking to you. Thank you so much indeed for giving us some insights, perhaps, on the Chinese view on this strategy that they've adopted. Thank you so much indeed for joining us.